My name is Dr. Teresa Bacon-Baguley. I'm a professor in the College of Health Professions at Grand Valley State University. Today we're going to talk about the co-occurring conditions with traumatic brain injury. By the end of this module, you should be able to identify co-occurring conditions seen in individuals with a traumatic brain injury. In addition, you should be able to identify the similarities and differences in the symptoms of traumatic brain injury and post-traumatic stress disorder. The common co-occurring conditions of traumatic brain injury are the following: post-traumatic stress disorder, chronic pain, substance abuse, depression, anxiety, as well as suicide. We're going to look at some of the more common co-occurring conditions in more depth in the following slides. Now, post-traumatic stress disorder is one of the more common states that's seen with traumatic brain injury. PTSD, or post-traumatic stress disorder, is defined as a disorder that develops after a distressing psychological event that is outside the typical human experience. PTSD is characterized by re-experiencing or reliving over and over again painful or stressful situations. The following film clip depicts an individual that has sustained post-traumatic stress disorder. There are a variety of symptoms associated with PTSD, which include the following: nightmares, flashbacks, avoiding stimuli associated with the trauma, recurring memories, poor concentration, trouble sleeping, anger, exaggerated responses, and hypervigilance. Hypervigilance refers to an over-response to what's going on in the environment. Now, if we look at the manifestations of PTSD and TBI, we're going to look at those manifestations that overlap and the ones that do not. We did mention this in the previous module, but there are some pretty common overlapping manifestations, such as poor concentration, memory impairment, insomnia, depression, anxiety, irritability, and even fatigue. Some of the unique characteristics of PTSD that you will not typically see in traumatic brain injury is flashbacks and nightmares. Whereas in a traumatic brain injury, especially in a concussion, one may see headaches and dizziness, which are not typical manifestations of PTSD. This is why a good history needs to be taken in order to establish whether an individual has a TBI or post-traumatic stress disorder, or both. Now, there have been many studies on the incidence of TBI and post-traumatic stress disorder. I'm just going to mention some of these studies in the summary that these individuals or these researchers found. Hoagie found that sustaining any type of physical injury in theater is known to increase a service member's risk for PTSD. Woliko in 2010 found that injury patterns with a TBI have greater comorbidity with PTSD than injury patterns without a mild traumatic brain injury. In other words, he found that those individuals that had a traumatic brain injury were much more susceptible to also have PTSD than those without a mild traumatic brain injury. PTSD can also exacerbate cognitive and other symptoms of a TBI, and this was found in 2004 with Lezak. In addition, blast-injured personnel may experience greater symptoms of PTSD. And as you recall from a few modules ago, blast-related TBI is extremely common in military personnel. Another co-occurring condition with traumatic brain injury is chronic pain. Chronic pain has many definitions which are usually based on the length of time the pain has persisted. In most definitions, chronic pain is pain that persists longer than 6 months. Chronic pain is a very common complication of a TBI. Approximately 81% of soldiers returning from the more recent wars reported symptoms consistent with chronic pain. That's a large percentage. The most common chronic pain locations are the back, with 58%, and the head, 55% of individuals. And some people have pain in both locations. As you can see, pain within the head can have overlapping manifestations with a TBI, where many individuals with a TBI complain of a headache. Chronic pain can coexist with other complications such as PTSD. However, a recent study found that chronic pain is independent of psychological disorders such as PTSD and depression. In other words, it's not due to having PTSD. Chronic pain is common even among patients with apparently minor injuries to the brain. Another co-occurring condition with a traumatic brain injury is substance abuse. There have been some risk factors associated for injury, such as sustaining a TBI. 18% to 66% of patients with a mild traumatic brain injury have a history of alcohol abuse. A third to half of patients with a mild traumatic brain injury or concussion test positive for alcohol or illicit drugs at the time of admission. These studies have identified that a history of alcohol abuse or illicit drug use makes an individual predisposed to sustaining a traumatic brain injury. Substance abuse also creates an obstacle for rehabilitation. An individual that is currently using illicit drugs or using alcohol has a diminished recovery from the traumatic brain injury. They also have a diminished benefit from the rehabilitation. In addition, they run the risk of having seizures and high rates of reentry. Other studies have found that a pre-existing substance abuse diagnosis at the time of injury predicted heavy drinking following the injury. In summary, there are many co-occurring conditions with a traumatic brain injury. Many of the manifestations between these co-occurring conditions make it difficult for a diagnosis. And it's important to identify what conditions are existing so the proper treatment can be obtained. This is the end of the module, which discuss co-occurring conditions with traumatic brain injury.